system, the work of your immune system is to fight infection, fight diseases. What's up, beautiful people? Welcome to another exciting episode of Health Savvy with Dr. Who you already know. And today, as usual, I'm excited to bring you another interesting topic. So basically, there's this topic that's been trending in the media and everything. If you live in Nigeria, you know that, Nigerians don't really have health-seeking behavior. However, lately, there was a Nigerian actress that came out and said that she has a few years to live, and she was diagnosed with a medical condition or a disease called lupus. So it struck up a lot of emotions in different people. Some were scared, some were worried, like, okay, what is lupus? Am I at risk of lupus? Is this a new thing that is flying around in the air? Is it contagious? Can I get it? And others were feeling sad for the actress, like, what's so serious about it? Why have they given her like a potential time to live, right? Like, is it like cancer that is time bound? And like terminal cancer, when it has reached the terminal stage where it has spread around the body, they tell you, oh, you only have a few months to live. So that's pretty much like what she said, that she's been diagnosed. So people are really wondering that this lupus thing, we've never heard of it before. What exactly is lupus? Am I at risk? Like, what are the possible outcomes and everything if perchance I'm at risk of lupus, or I find out tomorrow that I'm diagnosed of lupus? Anyway, you guys, not to worry. Like I said, I'm always here for you, right? And by the way, this topic is a special video request. So remember, if you have any requests, just write it in the comment section or send me a DM, and I'll be more than happy to shoot the video for you. Okay, so let's jump right back into it. So what exactly is lupus? So lupus is something that we call an autoimmune disease, right? Yeah, that sounds like a very big medical word, but don't worry, that's my job. I'm here to break it down for you. So what does that mean? Normally your body has an immune system, and what does your immune system do? Your immune system, the work of your immune system is to fight infection, fight diseases, fight everything. So all those bacterial infections, fungal infections, viral infections, your body is fighting and protecting your body against this infection. So if somebody is just coming and coughing into your face, your body's immune system is just like, hey, stop right there. You're not allowed to pass this zone. So you don't get the cough, right? Because your immune system is protecting you from that cough. That's why you don't fall sick every single time, because your immune system protects you from external forces. So bacteria, microorganisms, and all those things, right? But in the case of lupus or an autoimmune disease, instead of your immune system to fight external forces, the immune system is fighting you. When you have an autoimmune disease, instead of your immune system to fight the external forces or invaders, your immune system starts to fight you. So you can imagine that is a serious disaster. Like, immune system, is there something wrong with you? Are you crazy? Like, you're not supposed to be fighting me. Hello, you're supposed to be fighting the enemy here. But no, the immune system is confused and is now fighting you. So it's now fighting against your own body's healthy tissues and all that. And of course, you can tell that's going to cause a series of problems. So that's basically what's happening in lupus. The immune system, instead of fighting infections outside the body, it's now fighting the body's own tissue. So what does that do? When the immune system is fighting infections, it destroys all those microorganisms. So instead of destroying microorganisms, it's now destroying your body tissues. So basically, your body is starting to self-destruct. Lupus can affect a lot of organs in the body. It can affect your heart, it can affect your kidneys, it can affect your lungs, it can affect your brain, it can affect your joints, it can affect your skin. So, the amount of damage that can happen as a result of this is endless, right? Just imagine your body is fighting your kidneys, fighting your lungs, it's fighting your heart. Those are vital organs. It's fighting your brain, it's fighting your skin. Like, at the end of the day, what's left? Do you get what I'm trying to say? So this is why the condition is very serious, and is actually mysterious because the cause is not fully understood as of now. The cause is currently unknown. However, there are some hypotheses that maybe this could be as a result of genetics. So you are genetically predisposed to it. So most people that have lupus, they don't just have it out of the blue, right? It's in the genes, right? They are genetically predisposed to having it, right? And so maybe when they are born, it might not really manifest, but some things could trigger the lupus, right? One of them could be taking certain drugs. So for example, if you take antibiotics, those of you that abuse antibiotics, certain antibiotics could trigger this. Certain medications for seizures could trigger this. Certain blood pressure medications could trigger this. But the good thing about drug or medication triggers is that once you stop taking that medication, severity of the disease or whatever subsides. Another thing that can trigger it is infections. When you have infections in your body, it could trigger the lupus effect, and then your body starts fighting its own health issues, right? And then one more thing that triggers it is sunlight. So just imagine sunlight that everybody loves, sunlight that is giving you vitamin D, is triggering someone else to have a condition, right? Or it's triggering someone else already pre-existing condition that they didn't know about, right? So those are the three major things that have been found to trigger this lupus. So someone might ask, like, okay, what are the possible symptoms? How would I know if I have lupus? So let me tell you first of all that lupus is very difficult to diagnose because it mimics a lot of symptoms that other diseases have. Remember that it attacks different parts or different organs in the body, right? So it's going to be giving symptoms related to those organs, and it's like, okay, this can be, like, for example, if it's affecting your joints, you might be thinking you have arthritis. If it's affecting your lungs, you might be thinking you have a lung infection, right? So it's really difficult for doctors to diagnose. It's not that easy. But some of the symptoms you can have, if it's affecting your brain, you could have, for example, memory loss, right? If it's affecting your lungs, you could have chest pain. If it's affecting your skin, there is a characteristic rash, right, which we call the butterfly rash. So it's somewhere here on your nose, and then it goes all the way to your cheekbones, and so it basically forms a butterfly on your face. So you basically have a mask on your face. That is one of the very obvious signs of lupus, and there'll be a picture somewhere on the screen so you can see what we're talking about when we talk about this rash, right? It's a very, very obvious sign of lupus. So if you see that, you can be like, okay, maybe this person has lupus, or maybe I have lupus, right? That's one of the signs. And normally skin manifestations are usually triggered by sunlight. And then sometimes you can have other rashes on the skin, right? So those are just a few of the symptoms, but these symptoms, like we say, they are non-specific. So which means it doesn't mean for sure this is lupus. It can be any other thing, right? So basically for doctors to diagnose it, they have to rule out other causes before they finally arrive at, okay, this is lupus. And of course, there are other tests that your doctor will do. They'll do a series of blood tests, they can do a series of urine tests, and imaging tests if they suspect like the lungs and the brain are involved, right? So they're going to do a lot of tests before they finally arrive at that diagnosis. But these are a few of the symptoms that you can have. Of course, there are a variety of symptoms, right? But these are just a few that I mentioned. And one thing you should know is that lupus is very common in African people, in African Americans, and in Asians. So don't be surprised if you see people like this having it. And there are certain groups of people that are more predisposed to having it. So for example, it's more common in women for some reason, whatever reason. It's more common in women, and it's more common. So basically, people that are genetically predisposed, they might not show symptoms. It's usually seen around the ages of around 15 years to 45 years of age. Most times people usually have like mild symptoms, right? And then they have something that we call flare-up. So you might just have mild symptoms that they're managing, and then you might have a serious flare-up that is triggered by like sunlight infection or something. Then you might have to take like really serious medications and all that. And then in terms of prognosis, like why could they have possibly told her she has a few years to live, right? So prognosis means what's the outcome after you have a disease or whatever, or you've been diagnosed of a condition. What's the outcome? So are you going to be totally healed, or is the condition going to totally disappear, or is it going to live with you forever, and is it going to cause that much damage? Like prognosis mean like, okay, what's going to happen after I have this? Is it going to go completely, or am I going to live with it forever and have to take medications, or is it going to shorten my lifespan? That kind of thing. So that's what they're really saying when they're talking about prognosis. So that will be determined by the severity of the illness and the organs involved, right? Maybe in her case, maybe it has affected her kidneys, or it has affected her lungs, or whatever. We don't know, right? It varies for different people. No two people with lupus have the same symptoms. Symptoms vary depending on the organs affected. It varies depending on the severity of the illness and all that. So it's difficult to tell, right? But one thing is that this lupus has no cure. It has no cure at all. So when you're diagnosed with it, you live with it for the rest of your life. You're basically being managed on different types of medications. That's basically the summary of this lupus disease. I try to break it down in the most simple way, and I summarize it, trust me. Like I could go on and on and on, but you guys will get bored and you stop watching this video. So I just decided, let me stop right here. If you have any questions about what we discussed right now, please don't hesitate to put it in the comment section down below, and I'll be more than happy to answer them. If you have any video requests, also put it in the comment section down below, or send me a DM, and I'll be more than happy to honor it. If you liked this video, please don't forget to click the like button. Subscribe if you haven't subscribed already. right? And share this video with someone that you think might need to see this, especially now that this topic, a lot of people are asking questions about it. You might have friends that are wondering, that are asking, and are like, okay, why is this so, right? You can just share this video to them to explain that, okay, this is the answer to your question, right? Thank you so much for watching. Don't forget, a healthy you is a happy you. See you next week.